Hello, and congratulations on your new ophthalmic technician position at LAOC. I'm Dr. Nahornyak, Clinical Supervisor and Optometrist at LAOC, and today we're going to run through the basics of a standard workup diagnostic exam. In this 5-part training series, we will cover the following subjects. 1. Patient intake, which overviews the beginning of the patient's visit. In this section, we learn more about the patient's medical history and the details of the reason for their visit. 2. Distance vision, lensometry, and autorefraction, which overviews the patient's distance visual acuity in their habitual glasses, measures the prescription in their habitual glasses, and obtains the corneal curvature measurements, respectively. 3. Manual refraction, which measures the patient's refractive error and determines their eyeglass prescription. 4. IOP and tear lab testing, which determines the intraocular pressure and measures the tear film stability, respectively. 5. Lastly, dilation and diagnostic testing, which will allow for proper examination and imaging of the patient's retina, cataracts, and other ocular structures. Throughout our training sessions, we will thoroughly review our patient portal software called MDI, which is our office's primary reporting platform that you will use for all the appointments. To access MDI, log into any LAOC computer and click on the Next Tech icon. Once logged in with your credentials, long-click your patient's name and drag it to your workup room. A window will appear for you to select Tech Workup or Tech Workup with Refraction. Be sure to choose one of these options according to whether the patient wants a refraction done. This can be changed at any time during the workup, as a patient may change their mind. Click the patient's name and select Summary in the drop-down menu. This will open the patient's summary window, which lists previous diagnoses, follow-up plans, etc. Select the white Pro icon on the top right corner of the window to open the patient's chart. Once you're on the patient's chart, you will see a list of key sections that are noted in large text with a faint checkbox beside it. Once a section is successfully completed, we can click on the checkbox, which will turn it green, noting that it is complete. Before we move on, let's review all the relevant sections we will be focusing on in our appointments and in MDI. History breaks down the patient's medical history as well as info about their visit. In this section, we log various issues the patient is having, as well as note treatments they have previously used, if any. PFSH-ROS, which stands for Past Family and/or Social History and Review of Systems. In this section, we log systemic medications the patient may be taking, and additionally review family history. And lastly, VNP, which stands for Vision and Pressure. In this section, we log measurements that we obtain during the patient's visit, such as vision, pressure, lensometry measurements, autorefraction measurements, manual refraction, and dilation. Throughout your training, we will occasionally include pop quiz sections to test your understanding of the concepts and review. If you have any questions, please feel free to ask another member of our team. In this video, we will cover the patient intake and history process, starting with the patient arriving, obtaining their chief complaint, and ending with reviewing their medical and personal history. As always, we start with the patient arriving. Once the patient arrives and checks in, greet the patient in the lobby and bring them over to the Tech Workup room. The first step of the workup is to find out what brings the patient in for an exam today, or their chief complaint. Be sure to confirm the patient's date of birth.
Hello, Mr. Allscripts. Can you please confirm your date of birth?
January 1st, 2001.
Awesome. So what brings you in today?
I just haven't had an eye exam in a while, so I kind of wanted to make sure everything was okay.
Okay, got it.
This now brings us to our first instance of using the MDI software, which in this case will focus on the History tab at the very top of the page. You will see a large blank yellow space next to Encounter. This is where we will log info about whether or not the patient is new or recurring. If the patient is new to our practice, we log the following information exactly as it is written below. If the patient is an established patient, we write the following information exactly as it is written below. Additionally, be sure to select your initials in the text section on the right side of the screen. This indicates that you performed the workup. Within the History tab, you will see the HPI section, which stands for History of Present Illness. We will log the chief complaint, which you can shorten to CC, within the software. Next to the chief complaint, we will log information related to the following. 1. What is the chief complaint? This can be a basic summary of why the patient has come in today. 2. Which eye is being affected? We note this using the standard abbreviations OD for right eye, OS for left eye, or OU for bilateral. 3. How long has this been going on? Does it occur once a day? Twice a week? Once every several months? Please note how often the issue takes place. 4. When or how often does this happen? 5. Lastly, does anything help to relieve the symptoms such as artificial tears or blinking rapidly? Note: if one was to simply write new floaters as the patient's chief complaint without specifying which eye, how long it's been going on, etc., it is not complete and we do not get the full picture of the reason for their visit. If there are any additional notes to be added to support the patient's chief complaint, please add them into the Extended HPI section just beneath the chief complaint.
And any other complaints such as itching, tearing, dryness, anything
They
at
feel
all?
a little dry sometimes.
A little bit,
Yeah,
okay.
A little bit.
How long has that been going on?
Same thing. Like 2 to 3 years. If I work too long, they feel a little dry.
Okay.
After you have finished the HPI section, please check off the mental status exam checkbox. After we have thoroughly reviewed the patient's history, it is time to move on to record any specialty medications the patient may be on. We log this information in the Specialty Med section beneath the HPI section. In the middle of the tab, you will see a yellow bar which works as a search bar for various ophthalmic drugs or eye drops. Ask the patient if they use any drugs, and if so, search for the drug in the search bar.
And do you use anything to help with that?
I use some drops. I got them from the pharmacy. I think they're called Sustain.
In this situation, the patient mentions that they use artificial tears or drops to treat their dry eye. The patient confirms using Sustain preservative-free, so we find this drug within the search bar and select it. After selecting the drug, on the right side of the screen, we log various notes about the usage of the drug, such as dosage, dose unit, and schedule. Ask the patient how often they use the drug and what the dosage is.
Okay, and how frequently do you use them?
Like maybe twice a day or so.
Okay. In both eyes, correct?
Yes.
The patient then confirms how often they use the drug, which in this situation is twice a day. We note this in the schedule section using the term BID, which in medical terms means twice a day. In this situation, we note the patient's dosage as 1, meaning 1 dose, and BID, meaning 1 dose twice a day. Lastly, we select the administer, which refers to how the patient takes the drug. In this situation, since we're talking about eye drops, we choose OU, meaning both eyes. Other options may refer to taking an oral drug by mouth, such as an antibiotic. Note: for ophthalmic eye drops in the Specialty Med section, you must include when the patient's last dose was in the comments section at the bottom of the tab. Be sure to write today's date following the dose, which will show the doctor that this was asked and updated today.
And when was the last time you used them?
This morning.
All right.
After you have finished the Specialty Med section, you can check off the History tab at the top left, closing the section of the workup. Please note, you can always return to this section to log more notes about patient history, which is often the case on many workups. To do this, simply click within the History section. After we conclude history, we then move on to the next section, past family and/or social history, and the review of systems. In the past family and/or social history section, we review the patient's medical history, beginning with the past medical history. Be sure to ask whether the patient has diabetes, high blood pressure, or high cholesterol.
All right, so I'm just going to review some of your medical history since it's your first time with us. So do you have any medical conditions such as diabetes, high blood pressure, high cholesterol that you follow with a doctor for?
Yeah, all 3 of those.
All 3, okay.
If the patient notes having any of these, or other medical histories, you can search for these within the yellow search bar in the middle of the tab. When selecting a medical history diagnosis, ask the patient when the medical history diagnosis began.
Okay, so with the diabetes, do you recall what year you were diagnosed in?
I want to say maybe like 4 years ago, but I'm not
4
sure.
years ago. Okay, so about 2020?
Yeah.
In this situation, we ask the patient when the onset of their diabetes was, which we note in the onset section. We do this for every aspect of medical history the patient lets us know about. If the patient is diabetic, be sure to ask what the patient's last hemoglobin A1C number was and when the blood work was done.
All right, and do you recall your last hemoglobin A1C?
6.1.
And when was that blood work taken?
About a week ago.
Okay.
Since this is a history-related issue, we log this information back in the HPI section of the History tab. To do this, start a new info log by clicking in the blank space next to the chief complaint. When doing so, you can fill out the HA1C notes in the yellow space next to the hemoglobin A1C. In this situation, the patient remarks that his hemoglobin A1C reading was 6.1, with the last blood work being taken 1 week ago. We note this within the yellow bar. Additionally, be sure to mark today's date on the Date tab to the right. Be sure to ask who the patient's primary care physician is, and note this at the top of the screen.
And who's your primary care doctor?
Dr. Awad.
Okay, how do you spell that?
A-W-A-D.
Very good. And where is he located? He or she?
I think he's somewhere in Queens.
Okay.
I don't know the exact address.
All right. So because you're diabetic, we'll make sure that we send a report to your primary care doctor at the end of the exam.
You can enter the information by clicking on the plus sign next to treatment. Any information logged may need to be reported to the patient's primary care doctor. Next, we move on to the surgical history section, noted by Surgical HX. In this section, we note any surgeries the patient may have had in the past. Like we did with past history, you can pick out the surgery in the middle of the screen and note the approximate date of the surgery on the right-hand side. Next, we move on to medicinal history, noted by the Systemic Meds tab. For this section, it is always helpful when a patient has a list of their medications, but if not, you can look at their history through the ERX system, which syncs up with their selected pharmacy.
Do you happen to have a medications list or recall
Yeah,
what you use?
I have it here. I brought it with me.
Oh, awesome. Thank you so much.
Do I just give it to you, or do you want me to read
You
it?
can tell me what you used. Yep.
I'm on metoprolol, 25 milligrams.
Okay.
Metformin, 500 milligrams.
In this section, list all of the medications the patient mentions, which can be searched in the middle search tab. Confirm each medication the patient is on, one by one, being sure to note whether a drug was discontinued by writing D/C in front of the medication. Do not X out a medication that was discontinued. After we log all past medications, we move on to allergies.
And do you have any allergies to any foods or medications?
Just seasonal.
Seasonal, okay.
Like we have done in all other sections, you can log the information stated by the patient in the middle section. After logging allergies, we then move on to family history. For family history, be sure to ask about glaucoma, macular degeneration, or blindness, as these are important family histories to note in our practice.
All right, and do you happen to know whether or not anyone in your family has glaucoma?
No one has glaucoma.
What about macular degeneration?
My grandma does have macular degeneration.
And is that on your mother's side or your father's side?
On my father's side.
Okay.
When a patient remarks about any family history, be sure to ask the patient who had this history, and note this on the right-hand side of the screen. Additionally, be sure to make a note about which side of the family this is on. After logging family history, we move on to social history. To expedite this process, you can click Defaults, which will automatically populate this section with the questions. Go through each question and fill in the relevant information from the patient. Our last section is Review of Systems, which is where we log referral information or how the patient found out about us. We also want to be sure to ask and note the last eye exam the patient had, and log this information in the info bar. Upon concluding this section, be sure to confirm everything is logged correctly, and if so, click the checkbox next to Past, Family, and/or Social History and Review of Systems to finish this section. Thank you for watching the first video of our LAOC University series. In the next video, we will focus on distance vision, lensometry, and autorefraction.